Mr. Chairman, Ranking Member, thank you so much for the opportunity to address the panel. I thank you each for your time, and thank you all for coming. I'm going to start with a question, and I don't mean it to sound facetious. How many of y'all sitting at that panel have delivered health care as a provider to someone in a rural community living below the poverty level? You have, in the last 24 months.
Yeah, I'm a volunteer for Remote Area Medical, so we work in Appalachia delivering care.
Good. Okay. So a lot of the conversation that we'll have, we will be able to connect with. Okay. As I go through this, one of the things that I want to explore is the regulatory cost that has been added to healthcare delivery. Can y'all explain to me in the Affordable Care Act how there's an intentional effort to lower regulatory cost in the delivery of health care? And I'll start with Dr. Book.
Within the ACA?
Yes.
Within the ACA, I don't believe there's any attempt to do any of that.
Okay, thank you. Would you all agree that there is increased regulatory cost as a result of the Affordable Care Act? And Mr. Hasselmeyer, I'll ask you that question.
Yes, so that's not evenly spread. I mean, in more certainly more in certain sectors than others, but yeah, it's significant increased regulatory cost.
With that increased regulatory cost, and as a provider, this is something that I live with every single day. We are spending more and more time on regulation and less time on the most important part of healthcare delivery, and that is the intimate conversation between a doctor and a patient. As I move forward every day with treatment with my patients, the single most important thing that I have to be able to do is to communicate in an effective way with my patient the value of the health care that's being delivered. And I do that every single day. What I have seen in recent times is that we have less and less time to do that. How in the world, just because you have access to health insurance doesn't mean you have access to care. I'm sure that's been said many, many times around here. It is true. Has the Affordable Care Act looked at the other barriers to access to care besides simply access to insurance? I will tell you, in my practice, I treat patients every single day, from folks that are trying to figure out how to get their next meal to a family with unlimited means. I do it every single day in my dental practice. There are a lot of other barriers to care for those that are caught in a cycle of poverty. Dr. Bloomberg, you working in Appalachia can probably see that too. Transportation issues, education issues, all of those types of things. So a lot of times we're trying to solve a problem by providing an insurance product that really doesn't address the fundamental issues of access. We all assume that the number one reason that people don't receive care is because they don't have insurance. I'll argue that is certainly can be an issue, but it is also not the only problem there. So, Dr. Turner, have y'all ever, or Ms. Turner, excuse me, have you looked at the driving costs, or the other, excuse me, not the driving costs, but the other issues surrounding the cycle of poverty and the access to care?
You know, we have particularly looked at how discouraged physicians are, all medical providers are, because of the regulations that you point out. They went to medical school to treat patients, and they are forced to deal with so much bureaucracy that it's really discouraging and forcing them out of the practice of medicine, far too many of them, reducing the supply of people that are available, and this is particularly acute in rural areas. So yes, I'm very concerned about this I hope unintended consequence of the over-regulation of our health sector, but it's very real for patients.
Okay, thank you. Dr. Book, Ms. Turner touched on something that I think is very important, and that is the brain drain out of the healthcare industry. Can you make a quick comment on that? Do you see that trend continuing, or do you see it reversing as a result of the Affordable Care Act?
We have seen increases in physicians retiring early. I know very few physicians who would tell their children to become physicians. Most of them tell them not to, avoid it as much as possible. We've seen, I've heard on the regulatory side, I've heard comments from physicians that now that they're mandated to keep electronic medical records, it sounds like a great idea, but none of the systems talk to each other, and it ends up just taking more time to accomplish the same thing they accomplished before.
Dr. Book, I'm going to reclaim my last 20 seconds. I hope that as we move forward with this and find solutions, that we are able to truly drive the conversation back to the two most important people in the room, and that is the healthcare provider and the patient. That intimate conversation cannot be had by an insurance company or a government regulator. It has to be had between those two individuals. Thank you.
I thank the gentleman.